Good afternoon, everyone. Thank you so much for joining us. My name is Katie Rowley, and I am the Outreach Librarian for the NOAA Central Library, and I will be your seminar host today. Few logistics to get us started. This seminar is being recorded, so if you do have to step away or if you would like to share this with a colleague afterwards, it'll be recorded and up on the library's YouTube channel. And since we are recording, just a reminder that anything you comment or ask a question of will collect your name and that information, and that is only used to follow up with you on a question or if there are corrections made about this seminar. With that, if you do have any technical issues, such as you can't see the slides or you can't hear the speaker, please either chat me and I can walk you through some troubleshooting tips, but the best thing to do would be to quit the program. So X out in that small corner of your control panel and rejoin using that same link. That will solve most of your technical issues. So without further ado, welcome to the value of satellite-enabled reductions of exposure to poor air quality, a literature review. And we will have an introduction of our speaker by Jeffrey Adkins. Please take it away, Jeff.
Yeah, Jessica Chen just finished her Master of Science degree in Sustainability in the Urban Environment from City College of New York, and she is also a NOAA Graduate Research Fellow through the NOAA CREST program there. Jessica worked with me and Jen Sprague and Valerie Wary from the Weather Service on this project over the summer, and I'll turn it over to Jessica.
Hi, everyone. Thank you, Jeff and Katie, for introducing me. I'd like to thank everyone for joining my presentation today. As you might know, my name is Jessica Chen, and I'm a NOAA EPP MSI CESSRST scholar who just completed their NERTO, which stands for NOAA Experiential Research Training Opportunity. This summer, I completed my NERTO, as Jeff said, with National Weather Service, and I will be discussing my project today, the value of satellite-enabled reductions of exposure to poor air quality, a literature review. Just as a quick overview, the goal of the internship was to synthesize existing research that can be used by NOAA and other researchers to identify and address gaps in the understanding of the economic benefits of reducing public exposure to poor air quality. During my NERTO internship, I focused on reviewing research on the linkage between poor air quality, human health, and the NOAA investments such as GeoXO instruments designed to reduce the adverse health outcomes associated with exposure to poor air quality. Identifying the resulting improvements in human health outcomes from improvements in measuring and predicting air quality capabilities were essential. Studies conducted in 2020 through 2022 on the benefits of GeoXO's atmospheric composition capabilities provided a starting point for this literature review. So now I would like to briefly go over my time at Charleston, South Carolina, where I completed my NERTO. Starting from May to June, to begin the research, we branched out from this initial statement from an article by Fan et al. 2012, stating, we predict over 100,000 PM2.5 related premature mortalities and tens of thousands of ozone-related premature mortalities to result from 2005 air quality levels. Branching outward from this, I identified and reviewed relevant articles, as well as articles that cited Fan et al. 2012 in their work. During this time, I was also documenting all of the literature into a matrix, noting the themes, ideas, methods, and notable findings that are present in each. When July came around, I began organizing and creating a comprehensive outline from the 30+ articles and literature, as well as additional resources I've reviewed. From this, we were able to identify 5 scopes or trends in the literature. By August, the literature review was completed and finalized. Okay, so after reviewing over 30 relevant articles, websites, and journals, I found 5 main themes or trends, which we will be calling scopes, that were prevalent throughout the majority of the readings. The first scope was the contribution of satellite observations. The second scope was premature deaths. The third was other contributing factors affecting premature death due to poor air quality. The fourth was specific health impacts such as comorbidity and other relevant factors. And the fifth were policies. Now I'll be going over some of the key findings from each of these scopes. Starting with scope 1, which is the contribution of satellite observations. Ground-based air quality monitors were used around the 1970s to trailblaze research on the association among air pollution, mortality, and human health impacts. Since then, technological advances in satellite remote sensing enabled satellite observations that monitor atmospheric composition. This allowed scientists to model and estimate future air quality conditions. Combined with epidemiology methods, researchers can now calculate poor air quality associated mortalities, health impacts, and health risks. Estimates of air pollution exposure and associated health impacts are sensitive to satellite resolution, ground-based observations, and modeling methods. A sensitivity study on the relationship between spatial resolution of observations of PM 2.5 exposure and estimates of health impacts found that mortality estimates in rural areas were less sensitive to resolution level changes as opposed to urban areas. Enhanced spatial resolution in satellite observations can improve current modeling and prediction capabilities. For example, higher spatial resolution improved estimates of PM 2.5 concentrations, ozone concentrations, and the associations with premature mortality. As stated in Fan et al. 2018, while the network of air quality monitors in the US is extensive, it is spatially and temporally incomplete. This statement is supported by Wang et al. 2017, which states that the exposure assessment may be less precise in rural areas than urban areas, as there were fewer monitoring sites available in rural areas than urban areas to calibrate the prediction model. It is important to model urban areas because more people are impacted, but it is also important to model air quality in rural areas adequately, both for the benefit of rural populations and for use as an indicator of future air quality in urban areas, such as transported pollutants. Just to mention some of the limitations, in a recent meta-analysis study published in 2021, researchers excluded studies that solely use satellite observations due to uncertainties linked to satellite-based PM, such as poor satellite coverage in specific regions, cloud contamination, and year-to-year variability. These uncertainties impact premature mortality estimates. As mentioned earlier, geospatial satellites like the GeoXO can provide up to 12 observations per day, as opposed to the 1 to 2 observations provided by polar satellites currently. The increased observations will reduce effects of cloud contamination. The long-term observations from the 20-year GeoXO program will also reduce instrument-induced year-to-year variability. Moving on to scope 2, which is premature death. Starting with the Fan et al. 2012 statement mentioned earlier, we can see that there is an alarmingly large amount of premature deaths associated to poor air quality in the United States. Ozone and PM 2.5, which is particulate matter that is 2.5 microns or smaller, along with their related health risks, are the most frequently evaluated air pollutants. In a research article by Dadowski, 2020, it stated that PM 2.5 and ozone cause over 90% of total air pollution related mortality, supporting why these two pollutants are so widely studied and often used to quantify air quality. It was also noticed that since a large portion of the US population is concentrated in urban areas, much of the research focuses on urban air quality. According According to the latest census, about 80% of the US population lives in urban areas. I found that research pertaining to estimations of premature death associated with poor air quality exposure can differ for various reasons, such as varying parameters, years of air quality exposure, air quality concentrations, exposure estimates, modeling techniques, locations, health risk ratios and coefficients, spatial resolution levels, population projections, and baseline rates. Yet, estimates of premature mortality across research fall within a fairly narrow range despite the influence of these factors. The Dowsey et al. 2020 cited that multiple studies of premature mortality attributable to long-term exposure to air pollution, mostly PM2.5 and ozone, had results ranging from 90 to 360,000 deaths a year in the United States, based on 2005 through 2018 emission information. For Fan et al. 2012, modeled 2005 air quality concentrations and found 19,000 premature deaths attributed to ozone exposure and over 130,000 premature deaths attributable to PM2.5 exposure. Overall, the combined yearly premature mortality associated with poor air quality based off of Fan et al. Was at least 149,000 in the United States alone. In a follow-up study by Fan et al. Done in 2018, air quality concentrations were modeled by the respective year. The estimated premature deaths for 2005, 2011, and 2014 were 150,000 deaths, 124,000 deaths, and 121,000 deaths, respectively. Now, talking a little bit globally. A recent meta-analysis estimated that the annual global premature mortality attributable to PM2.5 alone was 253 deaths per million people. Another article found that globally, over 500,000 children under the age of 15 died from poor air quality in 2016, primarily those in low-income countries. These high mortality rates expose the need for more reliable air quality data risk communication, especially in vulnerable communities. Now, scope 3, other contributing factors affecting premature death due to poor air quality noted were chemical composition, atmospheric conditions, and natural hazards. Premature death attributable to air quality exposure can be affected by the specific chemical compositions of the atmosphere, including to, but not limited to, PM2.5, atmospheric conditions, and natural hazards such as wildfire and droughts. Air pollution consists of a mixture of gases, aerosols, and dust particles, which at high concentrations are harmful to human health. Chemical compositions such as air pollutant toxicity can cause and be associated with different types of health risk and cause specific mortality. Atmospheric conditions such as atmospheric conditions and natural hazards such as wildfires or droughts can exacerbate air quality conditions, thus influencing premature mortality and morbidity attributable to poor air quality. Now, for chemical composition, it is necessary to consider the implications of fine particulate matter. When looking into air quality research due to the varying toxicity levels of components and associated health risks. Fine particulate matter, which is particulates that are small enough to be PM2.5, contains a variety of particles such as soot, also known as black carbon, sulfate, nitrate, and many more. Due to the size of fine particulate matter, it is thought to have great health implications from deeper lung penetration and possibly entering the bloodstream. A study in 2015, which focused on source-specific black carbon emissions in 6 urban cities in the US regions, found that reducing 1 unit of black carbon increases life expectancy up to 9 times that of a PM2.5 unit reduction. Another study found that oxidant gases may enhance chronic health risks of PM2.5 exposure, mentioning that overall, our findings suggest that oxidant gases enhance the chronic health risks of PM2.5 in some areas. Reductions in oxidant gases concentrations may have the added benefit of reducing the public's impacts of PM 2.5, even if mass concentrations remain unchanged. These two studies highlight the importance of particulate matter composition research, the implicated health impacts of specific particle types. Now, as for atmospheric conditions, atmospheric conditions such as temperature and humidity could affect air pollution levels and exposure, influencing premature death levels. A study by Wang et al. In 2017 applied estimated air temperature to the method as an effect modifier and found that the health risk for long-term PM 2.5 and mortality increased by 0.6% for each 1 degree Celsius increase in temperature. Further research is required to understand the effects of atmospheric conditions on air pollution and human health. Now, as for natural hazards, beginning with droughts, in the Southwest US, extreme drought conditions increase aridity and the amount of wind-erodible dryland surfaces, affecting fine dust concentrations. This causes Southwestern US PM 2.5 levels to consist of almost 50% of fine dust particles during peak concentrations in the spring. These specific conditions, which affect the annual mean level of fine dust, impact morbidity and premature mortality rates associated with poor air quality. A recent study in 2018 estimated that future increased fine dust levels due to drought conditions could possibly lead to a 750 annual premature deaths in adults 30 or older in the Southwest US at a high emissions scenario. Further research is recommended to determine if source or region-specific air pollution is a significant factor which can impact health outcomes. Now, as for wildfires, in the past decade, the size, intensity, and frequency of wildfires in Western US have been steadily increasing. In 2018, Western US wildfire disasters in California alone cost around $27.8 billion, while continental US wildfire disasters in 2008 cost $1.7 billion. Exposure to wildfire smoke, which can be fine enough to be considered PM 2.5, can cause adverse health effects such as, but not limited to, premature mortality and respiratory ailments. With the projected increase of wildfire pollutants, a 2021 study projects that wildfire PM 2.5 attributable premature mortality can grow from 720 deaths from 1996 to 2006 base period to 1,900 deaths in a high emission scenario estimated for 2090. Moving on to scope 4. Specific health impacts, comorbidity, and other relevant factors. Air pollutants such as PM 2.5 and ozone can cause a variety of health-related impacts from short or long-term exposure. Research indicates that there are a specific set of health impacts associated with poor air quality exposure, such as premature mortality, lung cancer, cerebral vascular disease, chronic bronchitis, non-fatal myocardial infarction, which is a heart attack, chronic obstructive pulmonary disease, which is also known as COPD, asthma, pneumonia, cardiovascular disease, ischemic heart disease, dysrhythmia, congestive heart failure, upper respiratory symptoms, lower respiratory symptoms, and acute bronchitis. Interestingly enough, there was a handful of studies focusing on the cardiovascular and cardiopulmonary associations of premature mortality due to poor air quality. Some studies found long-term exposure to poor air quality, mainly PM 2.5, to be an important risk factor of cause-specific cardiovascular disease mortality. As for limitations, in the literature reviewed, references to comorbidity factors were limited, with research articles mainly mentioning morbidity as a health endpoint of PM 2.5 exposure, rather as factors that may worsen, exacerbate, or contribute to PM 2.5 associated premature mortality. Further research is needed to explore comorbidity factors and its relationship to poor air quality exposure and premature mortality. Researchers have also noted other relevant factors that should be considered for research further, such as the role of gender, occupation, age, location of living, income, and exposure levels with poor air quality associated mortality. The consideration of these additional factors are important in understanding the relationship between poor air quality mortality with biological and sociological factors. For example, lower income populations are at higher obesity levels and cardiovascular risk, which may influence the body's susceptibility to PM 2.5 or poor air quality conditions. Here is just a table created that notes the health outcomes from exposure to poor air quality. As you can see here, there are some measurements such as work loss days and school absent days, which are indirect health indicators that the EPA uses in their modeling. Finally, we have reached scope 5, policies or other measures to reduce impacts. The federal government's enactment of the Clean Air Act of 1970 initiated 4 regulatory programs targeting stationary source emissions: the National Ambient Air Quality Standards, NOAA-NWS, State Implementation Plans, SIPs, New Source Performance Standards, NSPS, and National Emission Standards for Hazardous Air Pollutants. The Clean Air Act amendments of 1977 primarily focus on establishing permit review requirements to support the National Ambient Air Quality Standards. The Clean Air Act amendments of 1990, signed into law by President George H.W. Bush, targeted 4 environmental and public health threats in America: acid rain, urban air pollution, toxic air emissions, and stratospheric ozone depletion. The amendments of 1990 also established national operating permits and strengthened enforcement of the Clean Air Act. The Clean Air Act amendments of 1990 were pivotal to the nation's air quality reform goals. They also galvanized research surrounding the potential impacts of air pollution and air quality improvements from policy measures. Air quality improvements can have a rapid impact on human health and premature mortality, with multiple studies reporting health benefits from short-term prompt air quality improvements. In a recent study conducted after the enforcement of the Clean Air Act Amendment of 1990, it found that air quality reductions from 1990 through 2010, such as estimated pollution-weighted annual average of PM 2.5, decreased by 39%. And the 1-hour daily maximum summertime, which is April to September, ozone, decreased by 9%. This resulted in more than 40,000 avoided deaths in 2010. The potential benefits of improved air quality or reduced exposure to poor air quality include reduced premature mortality, reduced morbidity, number of life years gained, and more. With the proper policy and standards in place, supported by advanced air quality satellite monitoring capabilities and modeling, human health benefits can be realized quickly. As for limitations, even with overall decreases in PM 2.5, certain areas, mainly in the western United States, are seeing slight increases in annual PM 2.5 level. The question remains, are current policies efficiently addressing air pollutant sources, or are they only focused on reducing air pollutants in highly populated areas? As said by Giannadaki, the existence of safe PM 2.5 concentration thresholds below which no health effects occur is considered ambiguous. Scientific uncertainty about the relative toxicity of particles emitted from different source categories is one of the major weaknesses in our ability to understand the relative contributions of each source to the PM 2.5 related mortality. Now, here are some key takeaways from this review. More than 130,000 Americans die prematurely every year from long-term poor air quality exposure. However, implementing effective policies such as the Clean Air Act of 1990, which improved air quality conditions, can help realize health benefits fairly quickly. Air quality improvements made from 1990 to 2010 resulted in more than 40,000 avoided deaths. I would like to just mention that we used the 130,000 premature deaths because it was from the highly cited article estimating the national public health burden associated with exposure to ambient PM2.5 and ozone, which is the FAN et al. 2012. It had over 600 citations since 2012 and over 33 citations in 22 alone, in the year 2022 alone. So, in conclusion, NOAA's future geostationary satellites, such as GeoXO, will include 3 instruments: an imager, sounder, and atmospheric composition instrument that supports and enhances U.S. capabilities to monitor and forecast air quality. Monitoring and forecast information allow people to avoid the harmful effects of exposure to poor air quality. Exposure to poor air quality contributes to several adverse health outcomes, and it also accounts for 130 to 320,000 premature deaths annually in the United States. With a better understanding of factors such as the chemical composition of pollution, toxicity, atmospheric conditions, and natural hazards, it is possible to have better forecasting and modeling, which in turn can aid in effective, efficient policy shaping. As for NOAA's investment, GeoXO has several advantages over other U.S. observational capabilities: more complete spatial coverage than ground-based systems, temporal resolution compared to polar satellites, and less corruption due to cloud cover than polar satellites. Now, I would just like to thank the people that made this possible, the NOAA-NWS SBES, which stands for Social, Behavioral, and Economic Science team, for mentoring me and taking me in, as well as my NOAA mentors, Jeffrey Atkins and Jennifer Sprague, for making this experience worthwhile. I would also like to thank my NOAA CESSRST team and mentors, Dr. Fred Mosheri, Dr. Shakila Merchant, and CESSRST for supporting me through this process. Lastly, I would also like to thank NOAA CESSRST for funding this opportunity. Thank you so much.
Awesome. Thank you so much, Jessica. We have ended slightly early, so if you have a question, please put that into the question panel, and I will be asking those of Jessica. But first, I'm going to throw it back to either Jeff or Valerie, who are on the back end here, to see if they have any questions or comments for Jessica.
Yeah, this is Jeff Atkins. You mentioned this briefly, Jessica, but could you maybe summarize some of your thoughts on directions for future research?
Yeah, sure. So I think for future research, it is important to incorporate risk communications and communities as well while doing this research. And I think a good direction would be looking into, I guess, chemical components of particulates. It seems to be a largely unknown space and area, mostly due to its limitations and capabilities of satellites and ground-based monitoring so far. And I think with the new GeoXO instruments, it may be very helpful to look into these aspects, such as toxicity levels of various pollutants.
Thanks so much, Jeff and Jessica, for that. We had a comment from Jennifer Sprague, who is listening in. She says, "Way to go, Jessica, well done."
Thank you, Jennifer.
I have a question for Jess, and Jess, this might put you on the spot a little bit. This is Valerie, but I'm curious what the most surprising thing you learned was. Like, what from all this research did you find the most interesting and unexpected and surprising?
That's a good question, Valerie. I guess the most surprising were the modeling techniques that were used and finding out that West Coast and East Coast PM2.5 composition is drastically different. However, a lot of modelers do not show that or incorporate that into their modeling, and that can skew a lot of, I guess, the health outcomes projected. So I think that was very interesting, as well as the large, I guess the large influence of dust components on the West Coast was very alarming. I guess that coupled with the wildfire, maybe the West Coast isn't as great as I imagined. So those were the most interesting things I found.
Thanks, Valerie and Jessica. We have one more question here, and this may be up to Jessica and Valerie as well. But the question is, when is this new GeoXO satellite launching? And will you work with the Tempo satellite as well for chemical information?
That's a good question. I think Jeff can probably answer when the GeoXO satellite is hopefully going to be launched.
Yeah, so the timeline on the new GeoXO satellite is in the early to mid 2030s, and so it is the follow-on to the current GOES-R, the GOES series satellites, and it will include the capabilities of the GOES series satellites and adding additional capabilities to that. The atmospheric composition instrument would be something that is not currently included on the GOES series satellites, and the sounder is something else that's not included on the GOES series geostationary satellites. And so in terms of reliance on the current satellites, Tempo and other satellites, the answer is yes. The information from those satellites is being used in a couple ways, and I'm not the best person to answer this. I'm an economist, and so I have learned this from others on the GeoXO team, and I'm trying to translate it fairly, but it's used in a couple ways. One is just practical use of the data, but also in laying the groundwork for how we might use the observations coming from to make better use of the observations that'll come from the GeoXO series.
Thanks so much, Jeff. I hope that answered the question for our attendee. I have a question for Jessica. So after your internship and your NERTO and everything has wrapped up, what is next for you?
Great question. Right now I'm exploring different types of opportunities that I may or may not be interested in, but I think I might just go travel for a little bit. But I definitely would like to either work in policy or something that has to do with air quality. So similar to what I've been doing all summer. But that's the future. That's the idea for now for the future.
Great, thank you, Jessica. Well, if no one has any other questions, I will remind you we did record this, so if there are pieces of the presentation that you want to revisit to hear again, it'll be up on the library's YouTube channel. But if we don't have questions, I can end this early and everyone will get some time back in their day. Any last comments from Jeff, Valerie, or Jessica?
A huge thank you for hosting this, Katie and Jessica. Wonderful, wonderful job. This was awesome.
Yes, thank you, Katie, and thanks, Val. And quick, I guess last note is air quality is very important. Hopefully people take it a little more seriously now.
We did have one last question. I believe Jeff prompted this one, but last question before I kick anyone off. Did you have an economic component to your analysis?
There were economic components in certain aspects, but we did not have enough time during my NERTO to delve deeper into them. But we did find that, I guess, since the research touches upon many aspects, articles that look more deeply into health components don't necessarily always include the economic components. So we only found a few articles that added economic values as well. So maybe in the future, we can also add that component into the research if it's further studied.
I will say that Jessica's work is a vital component of any economic analysis of the impacts of poor air quality and the benefits of observational systems in reducing those impacts. It's what we call a value chain where we look at the linkages between the observations themselves and the NOAA products and services that go out the door that feed into other products and services like FEMA's air quality forecasts and local air quality forecasts. And then continuing along that chain, understanding the linkage between the information that's going out the door and the human actions taken in response to that information and the health implications of making better decisions, of staying inside when it's not safe to get outdoors because of the air quality, especially for compromised people. And so laying that foundation is that identifying the linkages that translate improved observations into improved products and services, to improved actions, to improved health outcomes. That's sort of the foundation for any economic analysis of the dollar benefits of the observations that lead to these improved health outcomes. And so this was focusing on a specific component of that value chain. And the last piece, it would be to look at the economic value of saving those lives, of reducing the number of trips to the hospital, and that sort of thing. And you know, this is sort of the next to last step in that value chain that leads to some quantifiable economic value.
Thanks so much, Jeff. In the future, if you're doing research, the library would love to help you guys. So that's my plug for the library in this presentation. But with that, thank you all for joining us. I hope you have a wonderful and safe rest of your Tuesday. Please take care. And thank you again to Jessica for presenting today.
Thank you everyone for coming. Have a nice day.